Welcome to QD Clinic. I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live in Dallas, January 27th and 28th. We'll talk about those of you who want to attend virtually at the end. This QD Clinic is devoted to a case and a discussion I had just the other day about how to avoid knee replacement surgery. So the patient's an 83-year-old man who's had osteoarthritis of the knees and the hands, I must say, probably for 15 to 20 years. Hard to know. But he's previously managed by two other rheumatologists, previously just taken non-steroidals and some physical therapy, but never had injections, never had any advanced treatment besides over-the-counter therapy. So this has really been untreated. And the question is, they come to me because they want injections, and they want injections because they don't want to have surgery. And he's been advised by two orthopedists and one rheumatologist, he should just go ahead and have the surgery, and he'd do much better. And sure enough, this is a wiry, thin, 145-pound, 83-year-old who's got bony hypertrophy in the knees, flexion contractures of about 5 degrees in each of them. He walks with great difficulty in a cane, and he doesn't want to have surgery. To back it up, he also has coronary artery disease and was told that he needs a cabbage and refused to have that done, so he's not necessarily the best patient. But this issue comes up. How do you avoid the knee replacement in someone who really needs it? And his x-rays show significant, nearly bone-on-bone narrowing of the medial joint space. Lateral spaces in itself got its own problems. There may be some chondrocalcinosis going on there, but he's also 83 years old. I don't know that that's his primary disease. So he's got the damage. He's got the pain. He's got the dysfunction. What are we waiting for here? How do you avoid knee replacement? My point is, don't. And age is not a restriction to against having surgery that you badly need. I always point out that the famous comedian Bob Hope had his hip replaced at 91 when he had significant dementia, and he lived almost, I think, another 8 years. But guess what? He lived without significant hip pain in that 8-year period, and that was quality of life. So age is not a restriction. Get the surgery. Sometimes patients just need to be told to do it. But obviously, if there's restrictions as to why they shouldn't do it, you need to inform them of that. Someone reminded me yesterday that I'm famous for saying something like, "You ain't doing nothing. If you ain't doing nothing, you ain't doing no good." Meaning, if your choice is, I ain't going to do anything, well, then you're not really doing any good to the patient. Sometimes you just got to make a decision. And every patient that gets signed up for joint replacement has second doubts, wants to back out, wants to delay it. Maybe I can wait till next year. Let's wait until spring break when, they got stupid, crazy excuses. Just bite the bullet and do it. And I can say that with great confidence because I was one of these people. And I had my knees replaced almost 10 years ago, and I talked myself out of getting knee replacement, even though I had a horrible, osteoarthritis of the knees. And I'm so glad I did it. So, again, drug therapy gives you, a margin of benefit that's this big. Compared to drug therapy for OA, joint replacement is about 100 times better. Now, there's always a risk for side effects and complications and post-operative pain, but can you delay it? So this patient came in and they wanted to have knee injections. I got to tell you, I'm really good at getting a needle into a really small space without using an ultrasound, and I got it into one knee with no problem, and I barely got it into the other knee with a great deal of difficulty. So if I'm going to do that again, I'm going to have to use ultrasound to do that. So one way is, use corticosteroid injections, but I don't like to do those repeatedly. I'll do it once, twice, and then you should have surgery. What else can you do? Well, in many people, if they're not 83 and rail thin, weight loss helps significantly. Physical therapy helps significantly. Unloader knee braces can help significantly by changing a significant varus deformity to get you back to normal and unload that medial joint space. And then for people who have mild OA, unilateral, without significant malalignment and a varus deformity or valgus deformity, you might do a partial joint replacement done by arthroscopy. It's a go home the same day procedure, and it works very well. I don't think it works as well as total joint replacement, but there's some people who may be ideal candidates, but they're not the majority. It's only a few people. So the point is, how do you avoid knee replacement surgery? You don't. You got to pick your poison. It's either the pain of advanced joint disease or it's the mental anguish of having the surgery plus the recuperation. These are difficult decisions, and they are going to rely on you, the expert, and your experience with your other patients on how they can navigate that conundrum. That's it. I will remind you that RheumNow Live is a hybrid meeting for the 6th year in a row. We'll live stream this meeting to about 300 to 400 of you who'll sign up from around the world and watch this meeting. The experience from home is as good as the experience in the room. There's a lot of online discussion and chat about the lectures and the questions for the online audience. We are this year trying to do something we started last year by having our speakers, including the virtual speakers, get online with the online audience to discuss their presentations and answer their questions specifically amongst that online community. I think you'll find it interesting if you can't make the trip to Dallas on January 27th or 28th. Register at RheumNow.live. Take care.